Hello there, my name is Dr. Andy Toy, and today I am going to speak to you about one of my pet subjects, the consent process. I think there have been some massive issues around this in the last certainly 10, 15 years in my professional life, and some big misconceptions. So the main misconception for me is that we tend to see the consent process as a legal process. And we forget actually that really there should be the patient at the center of it. When we see it as a legal process, automatically we become more defensive. We tend to do things that will cover our backs, and we will tend to overdo the problems that may be associated with treatment just in case somebody's going to take us to court or the GDC. And we may become sort of cut off, I think, at the heart, because we're feeling so defensive. But actually, really good consent is not really a legal process. It's a patient-centered, patient care process. Of course, there's a little bit of legality in it, of course. But for me, that's just 5%. 95% of the consent process should be us really giving the best possible patient care, putting the patient and their needs all at the center of everything that we do. It's what we would want for us. It's what we would want for our friends and family, isn't it? So when I'm going through the consent process, I'm not thinking about the legalities, I'll be honest with you. I'm really thinking about how can I help this patient make the best possible choice for themselves? What is it about this patient, the way they are, their personality type, their social world, their background, their history? What is it that I can help connect with the patient and show them how what I'm advising as the best possible outcome for them, best possible treatment for them, how that will affect their lives? What are the pros and cons? What are the benefits and risks appropriate for their life? So I need to know the patient for that. And invariably there'll be three great things, and what could be better than long-term oral health? That is the best possible outcome for everybody. And if it's Invisalign, well, it's easier to cope with, or you get to see the result ahead of time, whatever it is. There'll be three great things, but there could be, in your head, 93 risks. 3 benefits, 93 risks. And if you're feeling defensive, you've got to go through every one of those risks. And you've got to look really serious and give them the worst possible outcome there could be if that thing happened. And how many patients then seeing 3 benefits and 93 risks, how many of them are going to choose the best chance of long-term oral health? Some of them aren't, are they? They're going to be too frightened. They're going to be put off. I don't think it's fair to give them 93 risks, even if every one of those was theoretically possible. We have to give them the risks that are very likely to happen to them and would be significant to them. Let's take root shortening as one. We know that with fixed appliances, on average, roots shorten by about 1 millimeter. Maybe it happens with Invisalign as well. We don't know. Even if it did happen, wouldn't it be better for that patient to have straighter teeth where they can look after them better, less wear, better function, or the dentistry they need is minimal, than worrying about 1 millimeter shorter root? So yes, I tell them about it, but I said, you don't need to worry about this. You've got good length of roots, good bone height. You don't need to worry about it, but I have to tell you about it. You see, I'm telling them the risk, but I'm also putting it in a balance for them. I'm using my professional skills, knowledge, expertise, and judgment to help them decide, well, actually, straighter teeth are better than losing 1 millimeter of root. Now, if they've come in with only 3 millimeters of root left, it's a completely different conversation, obviously, and that's because my consent process is patient-centered. So I need to know the patient very thoroughly. That's a very thorough exam, assessment, diagnosis, but also know them as a person. What level of risk are they willing to take? It's just the same as your finances. Some people would never take their money out of a bank. Some people won't even put it in a bank. Other people are very happy to have a high level of risk. They'll put it in cryptocurrency or whatever it is. You know, people have different levels of risk they're prepared to take, and we have to manage that. We have to manage our consent process to that individual. So just be aware of this. Really, really good consent is 95% patient care, 5% legality. And if you focus on that, I think you're going to give the patients the best chance of making the right choice for themselves. And usually, yes, they want the best chance of keeping their teeth for the rest of their life.